Hi everyone. Today I am giving you information on the topic blindness. This one is the blindness part 6, in which we'll explain you about the diseases that causes blindness. Disease prevention and control. So globally, the World Health Organization has identified the 5 major blinding eye conditions for the immediate action to achieve the goals of Vision 2020, which are cataract, childhood blindness, trachoma, refractive errors and low vision, and onchocericiasis. Okay, these are the major 5 blinding eye conditions which are chosen by the World Health Organization. So I have already discussed about the cataract as well as childhood blindness. Here I'll explain you about the trachoma, refractive errors and low vision, and onchocericiasis. So let's move to them one by one. Trachoma blindness. Trachoma is basically a disease which cause blindness to our eyes. So if you are noticing here that this one is the normal eye, okay, and in case of first stage, when we evert the eyelid, then inflammation is seen here in the first stage. Okay, in the second stage there is intense inflammation and you will notice that whitish spots are present at the lid, okay, which will cause a foreign body sensation into our eyes. In the third stage, the eyelid scarring is there and it will become smooth. The whitish spots starts bigger, and when the person closes and open the eyes, then eyelid scarring should be there. As a result, the eyelashes starts ingrowing inside the eye. It causes trichiasis. Trichiasis means misdirection of the eyelashes. Basically, the eyelashes are present outside our eyes. Their direction is outward the eye. But in this case, the eyelashes starts ingrowing inside the eye. They are starts ingrowing inside the eye, due to which they get rub on the cornea. When we close as well as open the eye, they will rub on the cornea. So as a result of rubbing, the cornea gets cloudy. In this way, this disease causes blindness, okay, at the different stages. If they get treated at the first stage or the second stage or the third stage, then we will prevent the blindness. But when it moves to its last stage, then we will not prevent the blindness and it becomes a major cause of the blindness. So trachoma is the leading cause of preventable blindness worldwide, with an estimated 5.9 million persons blind or at the immediate risk because of the trichiasis. Trichiasis is basically a misdirected eyelashes. Due to the misdirection of the eyelashes, it becomes an immediate risk of the blindness. The disease accounts for nearly 1/6 of the global burden of the blindness. In India, the blindness due to trachoma is on decline. The RAAB survey, which was done in 2006 as well as 2007, have reported trachoma blindness to be 0.6%. Okay, so this was all about the disease trachoma which causes blindness. So to prevent it, safe strategy is used. Now, surgery to correct the lid deformity and prevent the blindness. Surgery should be done if the lid moves inside the eye, then lid deformity. Surgery of the lid deformity may be done to prevent the blindness. So if the direction of the lid becomes normal, then it will not rub on the eyelashes. It will not rub on the cornea. Okay, next one, antibiotic for the acute infection and community control. Antibiotic should be given to a person for the short term infections and it will be community control because it is an infected disease. Facial hygiene, the person who have the trachoma, it is a kind of infection, have to do the facial hygiene, have to clean the face properly. Environmental change included improved access to the water and sanitation and the health education. Okay, environmental change should be done, access to water, proper sanitation should be done, proper health education should be given, and proper cleanliness should be done to those areas which have these diseases. So safe strategy is used. Trachoma has disappeared from the North America and the Europe because of improved socio-economic conditions and hygiene. When the hygiene get improved, then it get disappear from these countries like North America as well as Europe. Research needs include validation of rapid community assessment techniques, identification of barrier to the acceptance of preventive surgical procedure, studying effective studies. The WHO has organized an alliance for the global elimination of trachoma by the year 2020. Okay, so it gets eliminated by the year 2020 after the Alliance organized by the World Health Organization. More studies, surgical procedures should be done. In this way, the blindness may be reduced due to the trachoma. Next one is the refractive errors and low vision. What is the aim? The aim is to eliminate visual impairment. Those persons who have the visual acuity less than 618 and the blindness due to refractive errors and the other causes of low vision. There are the many causes of the low vision. As the person have the low vision, that there are many causes of the low vision, and under the low vision those persons are come whose visual acuity is less than 618. Okay, so different type of refractive errors like myopia, hypermetropia, astigmatism, these are the kind of refractive errors, and some other causes which causes the low vision. It is estimated that there were 35 million people in the world who require low vision care, and 8 million are blind due to the refractive errors. Okay, so it get estimated that about 35 million of the people require low vision care. 35 million of the people have the low vision, and the 18% or the 8 million people become blind due to the uncorrected refractive errors, uncorrected myopia, hypermetropia and astigmatism. 8 million people get blind due to this. So what are the strategies used for them? Recommended under the Vision 2020 initiative includes, first one is the create awareness for the refractive error and demand for the refractive services. Okay, awareness should be created for the refractive errors, for the myopia, hypermetropia and astigmatism. Proper checking should be done, proper refractive services should be provided. Okay, because children are unaware of them, that they are not be able to see. Screening to identify individuals with the poor vision which can be improved by spectacle or the adult optical devices. First of all, the screening should be done. Okay, first of all we should get to know that the person is not be able to see, then we can help him or her. Okay, so first of all, screening to identify the individuals with the poor vision which can be improved by spectacle. If the improvement is done by spectacle, then we will provide the spectacle. If they require the optical devices in addition with the spectacle, then we can provide those to them. Refraction services to be made available to the individuals identified with these significant refractive errors. Okay, refractive services should be provided, will provide the spectacle power to the patient who have the spectacle errors. Next one, ensure optical services to provide affordable spectacle for the individual with significant errors. If someone require the optical devices, then we will give the affordable devices to them and affordable spectacle to them with the appropriate things, so that he or she can improve their quality of life. Next one, low vision services and aids to be provided for all those in need. Low vision services, how they have to deal in their life with the low vision. Low vision services as well as low vision aids should be provided to those persons who are in need. Those were the strategies. Next one is onchocericiasis. Onchocericiasis is a kind of disease or a kind of infection which is caused by the black fly. Okay, it is also known as the river blindness because it was spread in those areas who are surrounded by the water bodies. Okay, so this is the result of the onchocericiasis. Okay, it is a kind of infection which is caused by the black fly, and black fly infect the persons there. It affects the body of the patients as well as it can enter in the eye. Okay, and it cause these type of corneal opacity, due to which the person is not be able to see and became a low vision person or the blind person. Okay, onchocericiasis is also known as the liver blindness because it is found in those areas who are surrounded by the rivers, oceans or any kind of water bodies, and it is known to be endemic in the 37 countries. Okay, and estimated with the 17 million people are infected with the onchocericiasis. Approximately 0.3 million people are blind from the disease in the worldwide. Okay, 17 million people get affected due to this disease, and 0.3 million people get blind due to this disease in the whole world. About 95% of the infected person reside in Africa, where the disease is almost severe along the major rivers in the 30 countries. Outside Africa, it get also spreaded in the Mexico, Ecuador, Colombia, Venezuela and Brazil, America and Yemen in Asia. Okay, so it becomes a major cause of the blindness. Next one, aim, target and strategy. Now, what was the aim? The aim is to eliminate the blindness due to onchocerciasis by the year 2020. What was the target? Target is to develop the national onchocerciasis program with the satisfactory coverage in all the 37 countries where the disease is endemic. Okay, so they have to develop the national onchocerciasis program so that the endemic get out of the 37 countries. Next one, strategy. Strategy is to introduce community directed treatment with the annual doses of mactazine. Annual doses of mactazine given to the patients or the persons in order to reduce this disease which cause blindness to the people. The disease is expected to be brought under control by the year 2010. The disease get under control by the year 2010 if the present efforts in the endemic countries are successfully implemented. Okay, disease is expected to be brought under control by the year 2010 if the present efforts in the endemic countries are successfully implemented. Okay, so in this way these were the 5 kind of diseases which were selected by the World Health Organization so that we will prevent the causes blindness. This was the end. Thanks for your patience listening.